Good evening, my dear students. So now we can discuss the topic MCQ on personal hygiene. So let us see the questions of it. The first question: the most important aspect of hand wash is. The most aspect of the most important aspect of hand wash is friction. Then steps of hand washing are: first, wash palm and fingers, then back of the hand, fingers and ankles, thumb and fingertips, and last, interlocking of hands. Then, which is not included in the 5 moments of hand wash before touching patient surroundings. Actually, after touching patient surroundings, this step is there, but before touching patient surrounding is not. This statement is not included in the 5 moments of hand washing. So at last, I will show you how many exact moments of this hand washing. The next one: universal precautions in hospital involve gloving technique, mask, gowning, hand washing. So these are the universal precautions in hospital, and the purpose of following these universal precautions are to control the cross infection. Then next, before providing oral for unconscious patients, which reflex we need to check? The answer is gag reflex. Then the nurse re-educate the patient with diabetic mellitus. The nurse should re-educate the patient with diabetic mellitus about foot care if the patient makes which of the following statement regarding the foot care? And the answer is, I will try to walk with barefoot in my garden at least once a day. So after saying this, the nurse again has to plan for re-education to that patient. The next one: during the bed bath, the water temperature should not exceed the normal uh, the normal temperature is 110 degree Fahrenheit, but for bed bath the temperature should not exceed more than 110 degree Fahrenheit. Okay, the next question: the nurse providing personal hygiene care to the patient. The nurse should follow which of the following action to reduce the risk of infection transmission? The answer is clean from less contaminated to high contamination. So less contamination to high contamination. Then next, the nurse is providing care to an unresponsive patient. The nurse is providing care to unresponsive or unconscious patient. Which of the following action is appropriate for oral care? So what we have to do as a nurse when we are giving oral care to the unresponsive patient or unconscious patient? The answer is provide chlorhexidine spray to moisture the cavity. Then here also you can see fifth question already I said. For unconscious patient I mentioned it is not for particularly for unconscious patient, for normal persons also. Okay, for normal persons also, normal patient also, before giving oral care compulsory we need to check the gag reflex to that person. Okay, the next one, next, how frequently should nurse change the position of bedridden patient to prevent best sore? All we know, so this is a common question. The answer is every 2 hours. The next, the nurse should educate the client that hair care will promote good self-image. Then, while providing the hygiene care for an elderly patient, the nurse should keep fact in mind that the skin of old person requires less frequent bath. Finally, my dear students, as I said, now I tell you 5 moments for hand hygiene or hand washing. So when we have to do the hand wash, the first moment before touching the patient, and second, before a procedure we must do the hand wash, and third, after a procedure or body fluid exposure compulsory we need to do the hand wash, and after touching a patient, need to do the hand wash, and after touching the patient surrounding, we need to do the hand wash. And here you can see before and after touching patient there. Before touching a patient and after touching a patient, compulsory we need to do the hand wash, and before a procedure and after a procedure, compulsory we need to do the hand wash. Then after touching a patient surrounding, we need to do the hand wash, but before touching a patient surrounding, we should not do any hand wash. Okay, before touching a patient surrounding, this statement not included in 5 moments for hand wash.